It's all over in the Western Hemisphere. I think at the end of the day, we just think that if we don't eat, baby doesn't eat, which is not true. Baby's eating at all times through the placenta. So I think if you educate a woman and you talk to a woman, I think an educated patient is the best patient. So we have this long conversation at the beginning of pregnancy, and most women, when they're informed, they do the right thing.
Okay, you mentioned about the babies eating irregardless, because I know, for example, also after having a child, you know, they tell you once you're breastfeeding. Now this is a different topic, that you have to eat, because if you don't eat and you don't eat well, the child wouldn't be fed. You said that a child would eat irregardless. Could you kind of elaborate on that? Because if a mother is not eating properly or not eating, how then is that child?
Well, I mean, the baby eats regardless, but what I'm saying is it's important to eat healthy also. But it's been shown in studies in places where there were war in do you know World War I and World War II in Europe and so forth. It's been shown that for a baby to be malnutrition or not to grow appropriately, you have to be severely malnutrition to affect the baby. So baby eats regardless through the placenta. So on average, it is not a notion of eating for two. It's totally incorrect. But I understand the concept that woman wants to eat and have a healthy baby. But what's the most amazing thing with women is that you have women who's been smoking for 10, 15 years, and when they get pregnant, they just stop automatically. So on average, I would say the average St. Maartener does the right thing where pregnancy is concerned. The issue of drinking during pregnancy is not a big issue either. I think the average St. Maartener does the right thing during pregnancy, besides the weight gain. But smoking and drinking is not an issue.
All right. As for medical assistance, how often should a woman visit her doctor during pregnancy?
Well, it depends. What I've been pushing for in St. Maarten is a universal prenatal care program. We desperately need that because we have women that come to me and I do something else. We have a woman that goes to another doctor and they do something else, and that's a huge problem. And that many women come here after there's an issue with another doctor. I'm not saying they have to come to a gynecologist. Many women can go to a midwife or a family practitioner, but we all have to follow the same program, and that's not being done. So on average, I see a woman in the first trimester twice. First trimester is up to 12 weeks. Then after 12 weeks, we see them about 3 times again, up until 30 weeks, and then after 30 weeks we see a patient every 2 weeks, because after 30 weeks is when most bad things can happen. So we see patients more often after 30 weeks. So in total it's about 10 to 12 visits. But we have the issue of insurances also. Insurances only allow 2 to 3 ultrasounds for pregnancy, and I think that's far too little, because when you first come in you need one, at 18 weeks you need one, and after 30 weeks you need at least 3 of them to make sure that that baby is growing well and everything is okay.
Okay, so you talked about this universal standard, or
yeah,
a standard by which all practicing doctors and gynecologists can follow. Who would be the one to set something like that up?
Well, I think government has to take a step in, or the specialists can get together and do it. I think it should be a combination of two, but I talked to a couple people in the healthcare industry, and they said they're working on it, but doctors have to be involved, because you know the strangest thing, Angelique, is that what happens you can come from Holland or wherever, the US, and come to practice in St. Maarten, but you have to change what you do, because of our patient population is totally different. I had to change many things that I was accustomed to doing in the US when I came to St. Maarten, because our patient population is just totally different. On average, our patient population is extremely high risk, extremely high risk. Not because they don't follow instructions during pregnancy, but because of the comorbidity issues like high blood pressure, diabetes, weight gain. These are tremendous, and fibroids. Fibroids are such an issue in St. Maarten that if you have a fibroid, not only does it prevent you from getting pregnant, but it also causes for a complicated pregnancy. And I've worked in the US and all over, and I've not seen so many fibroids as I've seen in St. Maarten. You have women 25 years old with fibroids, so of course it complicates pregnancy tremendously.
Okay, so then can you kind of tell us, what is a fibroid?
A fibroid is a benign growth from the uterus. First of all, it's benign, it's not malignant, it's not cancerous. We don't know what causes it. It's multifactorial, it could be diet, it's definitely genetics. the U.S. and West Africa has the highest incidence of fibroids in the world. And of course, because of the genetic issue that we came from there, we always have these fibroids. But I think the Caribbean is, we have these massive fibroids at a very early age compared to other people who have large fibroids later on. We have large fibroids at a younger age, and it complicates pregnancy. It only grows on the uterus. And it just is a huge issue, and it is the #1 reason why we do surgery as gynecologists, fibroids. So I've seen a woman as young as 24 with fibroids and as old as 50-something with fibroids.
So would you recommend someone getting rid of the fibroid before?
Well, it depends. It depends on the location and the size of the fibroid. But I've had women who, of course, they come here and they diagnose that they have fibroid only during pregnancy. So, of course, you can't terminate a pregnancy simply because of a fibroid. But what women have to understand is that, and that's where the periconceptional counseling comes in, where you should get a checkup before you plan pregnancy. But the problem is most pregnancies are unplanned. So if a woman comes in here and she's 8 weeks and she's pregnant, she has a fibroid, we have to deal with it. But the problem is that fibroids grow tremendously during pregnancy. As the uterus grows, the fibroid grows. So many women hospitalized for the entire pregnancy, or at least a majority of it, because of fibroids. It's growing, the pregnancy is growing, and it's extremely painful. It's a very difficult pregnancy.
So it's very painful because this fibroid is growing along
Exactly.
with the baby.
And sometimes it impinges on the baby's growth. But it's a very difficult pregnancy because we can't remove the fibroid, but we want the pregnancy to continue. So that's what I would encourage women to do. If you're planning pregnancy, get an ultrasound before to see the state of the uterus, because on average in St. Maarten, I would say if you pick 10 women, 7 of them have fibroids, and possibly none of them know about it. So it's a huge issue.
But okay, so besides you recommending someone before pregnancy to have this ultrasound, then I think it also goes along with women doing their regular pap smear.
Yeah.
I believe if you do that, you will also know.
Yeah, that's what we encourage pap smears for, not simply to check for cervical cancer, but to check for other issues also. And that's why I encourage women to get their pap smears, because then we can encourage for self-breast exam. We can check certain things like cholesterol, and then we can do an ultrasound and check for fibroids also. So you're right. We encourage pap smears not only for the sake of pap smear, but for other issues, for annual exam. I think every woman should get an annual exam. And people think they can get cervical cancer, but I've diagnosed cervical cancer in a 25-year-old. People think it's an old woman disease, but it happens to very young people. But you have cervical cancer, you have normal pap smears, and you have cervical cancer. But there are so many things in between. And that's the issue. We want to catch those things in between before it becomes a problem. I've had a woman who had cervical cancer during pregnancy, or at least close to cervical cancer. But we want the pregnancy to continue. That's the problem. We simply can't do too much during pregnancy for things like fibroids and cervical cancer once a pregnancy is diagnosed. So that's where the periconceptional counseling comes into place.
We talked about what or how often a woman should visit her doctor. Could you elaborate a little bit as to what happens during these
the visits? Yeah, it depends on how old the woman is, first of all. But I try, I think we're a little spoiled in St. Maarten, where every visit a woman wants to see her baby. And I try to oblige at every visit. Any patient who come here can tell you that we try to do an ultrasound at every visit. And it's not necessary. It's totally unnecessary. I think on average a woman only needs 5 ultrasounds during pregnancy. But if a woman comes here, she simply wants to see her baby. But it's totally, totally unnecessary to do so many ultrasounds during pregnancy. And that's one of the reasons why we have lines backed up here most of the days, because a woman simply wants to know what's going on. And I think it's fair, but I think an ultrasound at 8 weeks, an ultrasound at 18 weeks, at 28 weeks, and about 32 and 35 weeks is sufficient for pregnancy. That's about 5 or 6 ultrasounds. And I'm trying to get insurances to recognize that, but they simply don't. But we still have to do what we have to do. One of the things you have to realize is I'm from here, and most women who come to me are from here, or wherever they're from. So I think it's a more process of, enjoying the visit and enjoying your pregnancy. And simply listening to the heartbeat, I think, is reassuring to a woman sometimes.
So besides wanting to do the ultrasound, what about the heartbeat? That, yes, you listen to every time.
Well, I don't need to do an ultrasound to listen to the heartbeat, but there's something reassuring about showing a woman her baby, regardless if it's 24 weeks, 28 weeks, whatever. A woman just wants to see her baby, and she's reassured. I think many women here come in with so many complaints, but once they see their baby, all these complaints, they don't disappear, but they just feel a little bit more comfortable.
So you do the ultrasound, you do testing, of course, for diabetes, you said?
Yeah, well, I only do, what I do is I do a focused prenatal care. I don't think it's wise for us to just do the same thing on every patient, because every patient is different. If a patient comes to me and she has a family history of diabetes, that's the only time I do the diabetes testing. I don't do it on every patient. And diabetes is the worst thing to have during pregnancy. But I can sort of tell, I mean, we check urine at every visit for sure, and if I can see a woman is leaking glucose, then I know that I should do the diabetes test also. So checking the urine during pregnancy is very important. Because another issue that's important in pregnancy in the Caribbean is preeclampsia, which is high blood pressure, swelling of the extremities and so forth during pregnancy. And it's a huge issue, particularly with young women and first-time pregnancies. So fibroids and preeclampsia, that's the major issue we have during pregnancy in St. Maarten. But as I said, if you go Europe, that's not an issue. Preeclampsia is much less. Fibroids is practically non-existent. So that's why I said in the Caribbean we have to have a focused prenatal care, and we have to have a universal prenatal care program. But that program can't work in Europe, or it can't work in the US. So we have to take our patient population and focus on those specific issues, and preeclampsia and fibroids are a huge issue.
Okay, so you said you basically tailor your visits then for the patient.
Yeah.
Because, for example, I gave birth on the French side, and I know they have like a regimen of tests that everybody has to do at a certain stage.
Well, I am very familiar with the testing they do, and I think it's worthwhile, but that's also an insurance issue, that the French side has a different insurance that they pay for these things, and that's why we have SVB, we have BZV, and they don't pay for much, so we have to, and I think actually what they do on the French side is a bit much. They do a lot of things, but we don't have to do all those things. We focus on the individual patient, and if they have a history of these issues, then we do these specific tests. But on average, I don't think you have to do it on every patient. That's why I said a focused prenatal care program is necessary instead of a huge package and you do for everybody. I think it's totally unnecessary and expensive.
Because from what I understand is there's certain tests that they do on the French side that is really European, because of cases that they see regularly in Europe. Yeah. But because of the connection, you know, they still do it here in the Caribbean.
Yeah, but I think, you know, I mean, it's an issue. If you do 10 tests, you might catch one thing, but that's not what we do over here. We do the test that we think is necessary instead of 10 tests. And I think that's the wise thing to do. It saves time, it saves money, and I think a woman appreciates that if you do the necessary tests, instead of sending her to the lab every 4 to 5 weeks, we can just do the tests that are necessary for her history. And I think that's the wisest thing to do.
Thank you for having joined us today on A Better Place. And we would like to thank our guest for today's program, Dr. Randall Friday, who gave us vital information concerning prenatal care. We thank you once again, and we do look forward to you joining us for our next program.